Hi, I'm Trevor Schufelt, a pharmacist at the Dauphin Clinic Pharmacy. Today we're going to talk about a very effective type of cholesterol medication called the statins and try to dispel some of the myths about statin side effects because the side effects to statins are really quite rare. It's a summer day. Sunlight streams onto a beautiful grassy field. A young woman in a white sundress spins and dances joyfully. Upbeat music pervades the scene. The narrator cuts in. Nozula may cause full body hair loss, projectile vomiting, full highball, the condition known as hot dog fingers, children born of the head of golden retriever, seeing the dead, possession by the Prince of Darkness. I love this E-Trade commercial from a few years ago. However, it does highlight my problem when I try to explain medication side effects to people. Some people only hear the worst possible case scenario when they start a new medication. If I tell a patient they have a 1 in 1,000 chance of having a side effect, they all answer the same way. They all say, I'll probably be the one who gets the side effect. So let me put it another way. 1 in 1,000 means 99.9% of the time you won't have the side effect. If I told you had a 99.9% chance of receiving $1,000 if you raised your hand, would you? Or would you be convinced that you'd be the 0.1% of people who didn't get the $1,000? Let's talk about some of the most effective classes of medications we have. They're called the statins. The statins are HMG-CoA reductase inhibitors, which means they stop the liver from making cholesterol. And they are particularly good at reducing something called LDL cholesterol, which otherwise we call the bad cholesterol. We have lots of studies to show that if we reduce someone's LDL cholesterol with statins, we reduce the chance of heart attacks and strokes by 25 to 35%. So obviously that is great for protecting brains, preventing strokes, and protecting hearts by preventing heart attacks. To put it another way, a doctor would only have to treat 23 patients to prevent one heart attack or stroke. 23 patients in 5 years to prevent one heart attack or stroke. That's a very effective class of medications. Not surprisingly, whenever we talk about statins, people ask about their side effects. The most common one is statins upsetting people's stomachs. Not everyone gets this, but it can easily be fixed by people taking their statins with food. The one that seems to get the most press are muscle pain and liver damage. Of course, these are possible. And if you get muscle pain all over your body, call your doctor and we'll check to see if it's an important side effect or not. And they might take you off the statin and the muscle pain will go away on its own. Liver damage, the doctors can actually do blood tests to see if there's any signs of liver damage. But again, if you have any, they'll take you off of it and the damage will resolve on its own. Let's put some numbers to those side effects. About 1 in 10 patients will have muscle pain. But this will be short-term muscle pain, and it'll go away and the patient will continue taking the medication. In about 1 in 100 patients will have persistent muscle pain. This persistent muscle pain will be bad enough that the medication will be stopped. Also, about 1 in 100 patients could have some muscle pain and a small increase in a liver enzyme called creatine kinase. But only 1 in 1,000 of those will have this increased liver enzyme, and that's high enough that the doctor will have to take them off of their medication. A rare but serious side effect of the statins is called rhabdomyolysis. Rhabdomyolysis is when an enzyme called creatine kinase is 10 times the normal level that's supposed to be, and you have muscle pain. Rhabdomyolysis is serious. It can cause heart problems, clots everywhere, and kidney failure. Rhabdomyolysis affects about 1 in 100,000 patients. In about 1 in 1 million patients, the rhabdomyolysis can cause death. Now stop yourself for a second. I threw a lot of numbers at you. Did you picture yourself as the 1 in 23 people whose statin saved you from a heart attack or a stroke? Or did you picture yourself as the 1 in 1 million people that a statin killed? Did you realize you are 43,478 times more likely for statin to save your life from a heart attack or stroke than it is for it to cause your death? We humans seem to be terrible at assessing risk. In their book Freakonomics, journalist Stephen J. Dubner and economist Stephen D. Levitt talked about swimming pools versus guns. If you have an 8-year-old girl named Molly who has 2 friends, one, their family owns a swimming pool. The other, their family owns a handgun. If you were Molly's parent, which of her friends would you let Molly go visit her house? Most people would automatically say, well, she can definitely go over and visit her friend with a pool, but she definitely can't go see her friend with a gun. But the numbers say Molly is more than 100 times more likely to drown in a backyard pool than to be killed by a gun. It's important to be informed, even if it goes against our gut feelings. Let's go back to the numbers one more time to put statin risk into perspective. In 2012, Manitoba had 108.5 injuries per billion kilometers driven. That means you'll have about 0.8055, which is about 1 injury per every 1 million kilometers you drive. So we're back to our 1 in a million chance of a problem again. Does 1 injury per 1 million kilometers driving stop you from driving? No, because if you drove 100 kilometers per day, it would take you about 27 years before you'd have an injury. The risk-benefit ratio really favors driving. The same with statins. A statin is 43,478 times more likely to save you from a heart attack or stroke than it is to cause your death. Those are great odds. We all react first with our gut. That's why casinos and lottery ticket sales are all in business. We all think we're going to win even when the math says we don't. If you didn't lose more often than you won, all the casinos and lottery ticket dispensers would go out of business. But try to remember the benefits of your medication when your pharmacist talks to you, not just the side effects. Now I have to go out and buy myself some Missoula. That hot dog fingers condition sounds delicious.